Guilford County healthcare providers say our area has a big problem. Where you lived often determines how long you're alive. Good evening, I'm Chad Silber.
And I'm Sydney Moore. Leaders highlighted the disparity between different parts of Greensboro at a meeting tonight. WFMY News 2's Denise McMiller learned how they plan to address it.
It's shocking to say, but there's a more than 10-year gap between people living on the east side of the city of Greensboro compared to those living on the west side. I mean, just look at the statistics. This isn't just an issue in the Gate City. In High Point, there's a gap between both sides of the city of 17 years. And in some Winston-Salem neighborhoods, there's a 10-year life expectancy gap. Now, a first responder in Bishop and Greensboro pointed out the fact that although there's access to health care throughout the city, its quality is not the same.
That's why we have to look at equity, because we have to be careful, because they'll say, we have funds to put this there. There's no x-ray machine. There's no CT there. I've got to make an appointment way down the road.
To tackle this issue, Mustard Seed Community Health brought city leaders and health professionals together to discuss solutions. Those at the table all agree that being healthy goes beyond having access to a doctor. It's also transportation, housing, and food access that play a part in the gaps in life expectancy. The chair of Cone Health says they're working to remove these barriers with programs like their mobile health units and the burrito market at the Med Center for Women, where patients can grocery shop for free.
I think it does take a holistic approach. It's not just about access to health, because you can get healthy, but if you're going back into a home environment that has many of these other conditions, then the overall situation for the individual or the family is not improved.
Panelists say it's going to take partnerships to improve health outcomes on the east side of Greensboro. They also highlighted the collaboration between the city and Cone Health on the Windsor-Chavis-Nocho Community Complex.
The Chavis Library is going to become a health hub for East Greensboro.
And Cone Health has what's called a Catch 5 in 5 initiative. The goal is to increase life expectancy by 5 years in 5 years.